in an amazing session which included 4 speakers and the ambience of this beautiful hotel, the Movenpick Islamabad, we were able to evaluate the malnutrition, the status of the malnutrition globally and in Pakistan, and of course its prevalence and its treatment options and its management. Start the day and it is my pleasure to be here. I've been associated with Ashar and his team for the last almost like 1.5 decades, 15 years. And this has been always a pleasure. We've covered most parts of Pakistan, and we are talking of business, we are talking of nutrition. So we commence today's lecture session. Before I go, let me talk something about the ambience. So we commence today's lecture session in a serene and intellectually enriching environment. You can see that, where the pursuit of knowledge is illuminated by the timeless wisdom, surrounded by the atmosphere, as you see, of reflection, discipline, and spiritual grace. We seek not only academic excellence, what we are trying to do today. The objectives today are the following. Nutrition is definitely a very important part of all therapies. When I started my teaching career only 44 years ago, I was always inclined towards medical treatments. But with the passage of time, I've realized that nutrition has an immense role to play in everything that we do in life. So let's go straight into what is malnutrition. It's a broad term that can be used to describe any disorder of nutrition. From the diseases of the developed world caused by overnutrition to the extreme of undernutrition found in the hospitals. Very important. It is like a mismatch. So describing further, malnutrition is a continuing. It progresses through a series of functional derangements that precede any changes in body composition. The latter are related to the duration of the reduced intake and its severity. Day of the week. Cognitive impairment is very important. Cognitive impairment, I'm a neurologist, is extremely important when we come to nutrition. If you don't have enough macro and micronutrients, if you do not have enough minerals, then your cognition will always be affected. Coming to multiple comorbidities, someone who has diabetes, hypertension, cardiac diseases, chronic renal disease, of course, they're all very, very difficult people to treat. And if together with that, they have malnutrition, of course, it is a combined effect. Then come to the psychological changes that occur when a patient or an individual is malnutrition. We all know that. I mean, you all are very well inclined towards teaching, and you all know what I'm talking about. Let me tell you, this is not a lecture session. This is just a discussion between friends. I'm sure many of you know much more than I do. We have nutritionists here, we have people from the medical ward, Rab Saab baithe hain yahan pe, and we have people who have already been dealing with nutrition for the last so many decades. Then we come to the polypharmacy. Polypharmacy is so important. We do not even know that what side effects, what adverse effects medical therapies can do. One has to be very, very careful. We keep on writing medication. We all do it. And we do not know how it can affect the nutritional status of an individual. So you can imagine how important it is to be well nutrited. Kahan se aayega? Khana kahan se aayega? Nutrition kahan se aayega? Ghiza kahan se aayega? Then we of course come to the socio-economic status, and these are all multiple and overlapping factors. So then we go to the definition of malnutrition. When you talk of the National Institute for Health and Care, this is coming from 2006, pretty old, but I'm sure it still goes strong. So, according to the NICE, the causes of malnutrition include impaired intake, of course, you all know, impaired digestion or absorption, of course, altered metabolic nutrient requirements, and of course, excess nutrient loss. So, the relative importance of each class of problem varies. Multiple factors often occur simultaneously. There's so many United Kingdom adults. So related with outcome of disease. So definition क्या है एस्पिन की? The definition of malnutrition. Adult undernutrition typically occurs along a continuum of inadequate intake. I've already talked about it, and or increased requirement. You have comorbidities, you have infections, then impaired absorption, of course, altered transport. You may be taking enough, but the transportation system inside the body is affected. And altered nutrient utilization. आप खा भी रहे हैं लेकिन यूटिलाइज नहीं हो रहा. When the Academy of Nutrition and Dietetics, A&D. So according to them, the definition is insufficient energy intake, weight loss, very important factor, loss of muscle mass, nutrition नहीं होगी, nutrition की intake सही नहीं होगी तो muscle mass तो होगा. Patient is emaciated. The bulk of the muscle is gone. And then, of course, loss of subcutaneous, very prone to malnutrition. Diagnostic criteria for malnutrition. So, diagnostic criteria क्या है? There are two criteria for malnutrition. Two alternative ways to diagnose malnutrition. Before diagnosis of malnutrition is considered, it is mandatory to fulfill the criteria for being at risk of malnutrition by any validated risk screening tool. So, number one, BMI under 18.5. Number two, weight loss, unintentional weight loss, or 10% indefinite of time or 5% over the last 3 months, combined with either BMI under 20, if under 70 years of age, or under 22 years, under 20 kg per meter, if 70 years of age, or FFMI. So all these, including in women and men, this is very, very important that these are the criteria for diagnosis of malnutrition. Coming back to aspirin, which is a very important agency in the world, malnutrition can be defined as a state resulting from lack of intake or uptake of nutrition, intake and uptake, that leads to altered body composition, decreased fat-free mass, associated with functional number one and clinical outcomes. This is another example of the Global Leader Initiative, GLIM, and this shows you all about patients with malnutrition.